All right, so Peggy has been with us for a little while here. So she started out doing both peripheral neuropathy, and then we started doing that, and then we got into doing some other metabolic work. So we'll get into that in just a second. So first of all, how did you hear about our office?
Well, Dr. White gave a seminar at the apartments, the 55 and older apartments where I live, and
Okay.
I saw a flyer, and I thought, oh, I think I have that, so I went to check it out.
So what were the symptoms that you were having that made you think, hey, maybe I should go listen to that seminar?
I was having numbness, starting to get numbness in my feet,
Okay.
and just in general not feeling as well as I used to, and I can see it was going to be like a downhill
Okay.
slope.
In fact, if I remember, you're like, I'm only 18 months away from
Yes.
retiring, and I want to feel good when I retire. I think that was kind of
That's right.
a motivating factor for
Yeah.
you. Okay, so you came in, we did an examination, okay? After we did the examination, I explained, okay, this is what I think I can do to help with the peripheral neuropathy. And she came in and she was a lot better than most people that come in. Most of our patients actually come in and they've got 70, 80% loss of sensation. Peggy wasn't there. She was less than 50%. But she saw herself getting bad and she didn't want to get there. So she wanted to take more of a proactive approach as well. So what made you decide to do the program?
Well, that was pretty much
Was that kind of it?
That was
I
it.
just spoke for you.
Thank you, yeah.
Okay,
it was
you just wanted
just
to kind
the
of...
way I felt, and I knew I was going to
Okay.
feel better.
And after, probably within just a couple of weeks, you know, one of the biggest concerns that she had is she is diabetic. Or she's been diabetic, and so she was concerned with that. So we put together an additional program to help with that, help with the metabolic stuff. And let's just kind of go into everything. So first and foremost, the coolest thing about everything is how much weight have you lost since you started our program?
40 pounds.
40 pounds. Now this is awesome. Now, if you don't mind, tell the audience here who's listening, how old are you?
64.
64. Okay, so most people that are 64 don't lose 40 pounds unless there's some major health issues going on, right? What made you be able to, because I'm assuming before you came into our office, you had done some diets and this and that and all that kind of stuff, lots of them. How do I say this? What did we do that was so different that allowed you to stick to it, and not just stick to it, but also conquer it?
There was a lot of support from this office.
Awesome. Okay.
That's what I needed, was someone right there. I could ask him questions.
And she was awesome because she would, like, every time she came in, especially in the beginning, she'd come in with this yellow sheet of paper with questions on it. Can I do this? Can I have this? Can I do this? And you know, I think that's great. And the reason is because you were fully invested in getting well. So not only has she lost 40 pounds, what was your blood sugars at in the beginning? Do you remember?
Oh.
She wrote them down. So she was awesome. She wrote them down every day what her blood sugars were. And they were high. They were really high, and that's including being on insulin and medication, right? You're on both, right?
On both.
So because of what we were able to do, she was at one time able to get off everything, right? Didn't you get off the insulin as well as metformin, and then you had to go back on a little bit of the metformin, is that correct?
I never really stopped the
Okay, I thought you'd stopped for a couple weeks.
I don't think I was even on it. Well, sorry.
That's okay. This is a live video. We're just we're just normal talking here.
Yeah.
But the best thing was you didn't have to shoot up insulin anymore. In fact, you kind of you were crashing, and we kind of said, "Hey, you need to check this out because it's not very good." So we she talked to the doctor. She was able to stop. Or did you just stop on your own?
No, I went and talked to my doctor.
Doctor, yeah.
About it, yeah. And she took me off of it.
Took you off insulin. So that's awesome. And you haven't had to do any insulin. You still do a little bit of metformin. Is that correct?
I do metformin.
Okay. And how long have you been diabetic for?
Over 20 years.
Over 20 years.
Yeah. Insulin, only 8 years.
Okay. But that is stinking awesome that because of what we did, you were able to get off insulin, and I believe your metformin is just minimal, right? In terms of what you're having to take.
Right.
And that's awesome for her.
My A1C.
Oh, okay. Let's talk about your A1C. Please do.
Okay.
What'd you start out with?
Oh, it was 9 something, and then went down to 7 something, and My very last one recently was 6.3.
Nice. And it was at
Without
9.
insulin.
Without insulin. And the 9 was with insulin.
Oh, yes. Yeah.
Wow. That's incredible. So how do you feel overall?
Oh, I feel marvelous. I feel really good.
You gotta like that answer. Oh, I feel marvelous. And I know you've put in whole heart into this. You've done everything that we've asked of you and more. What was your life like? How did you feel before compared to now? Because you didn't come in for diabetic work. You didn't come in for that. You came in because, hey, I don't want my feet to get worse. And then we kind of morphed everything into a whole health program, if you want to say. What did you feel like before compared to now?
I was having problems going up the stairs, not feet wise, but just
like
everything.
puffing.
I couldn't.
Okay.
It was getting hard to go up the stairs.
Wow.
Now I can run up the stairs.
Nice.
I do
Okay.
lots of exercise.
What about how did you feel just inside? Did you have like very low energy, all the kind of typical things that come with that?
Lower energy, brain fog.
Okay.
That
And is that all cleared out?
Yes.
So that's just, for patients, that's a home run. That is home run. So what have you liked most about our office? Besides me, of course.
Oh, that was my answer.
Well, you wanted to have something else, you know.
Okay, Nikhil.
Okay. What honestly, what did you like about the office? What made you, able to do what you did because of the office?
I like the support that I got.
Okay. No, and that's important. It's like in anything. Encouragement and I think part of it was you started doing well pretty fast. You started losing weight pretty quickly.
Well,
in the beginning. Yes, in the beginning, and that was way encouraging. And I think it's because you started seeing results. When you see results, you see results, right? So we just did her final evaluation, and she ended up with a score of 87, actually on both feet, 87 out of 92. That's a 5% loss of sensation. From where you started out, that is monstrous. Now, like I said, she didn't start out as bad as a lot of other patients that we've had here. But when she started out to go to less than 5%, that's incredible. Basically everything was 10s except for just a couple of things on both feet where there were a little bit lower numbers. But that is awesome. So is there anything else that you would like to say because what this is the reason we do the videos is because patients want to see real people that have had success, that are struggling with the same issues that they're struggling with. They want to know that there's hope. They want to know that what we're doing actually does work because, they want to hear from people that have really done it. So what would you say to those people who are looking into the program, deciding whether they should do it or not, kind of on the bubble of what they should do? What do you think why would they benefit from what we've done here with you?
You just feel so good. It's a big commitment. You have to be able to commit.
Yep.
And
and I tell people, and I told you up front, it's a commitment, right? But you're not going to know. You're not going to know what to do with yourself when you now on your Tuesday nights, right? She's been coming in just Tuesdays for the last few months, so now she's going to be open and not know what to do with herself. But honestly, Peggy has been a great patient. She has, like we've talked, she's done everything we've asked her to do. She has gone above and beyond. And the coolest thing is, if you've gotten results that were probably not even anticipated in a lot of things. Oh, tell about your.
Well, it was kind of a shock. My first scores. I didn't realize I had lost anything.
Exactly. And I tell people all the time. In fact, I've been using the number when I do my seminars now. I really believe, I don't have any stats to prove this, but I really believe in what I've been doing, that I think most people don't even realize that they are starting to lose sensation until they're past 30-40% of loss of sensation already. They just, because it's so slow, a lot of times they don't realize it. Now, one thing you were saying about your shoes, like all women, they like to shop. So what were you saying about your shoes?
Oh, before I started seeing Dr. Watt, I was having a problem finding shoes that didn't hurt. Even if they fit, they still hurt, and I was just wearing like flats and stuff. That's all I could wear. I was just telling him that today now, or not just starting today, but I'm able to wear normal shoes.
Any kind of shoes
And-
she wants, including the stilettos.
No.
She was joking about that. No, but that's important because guess what? It's a life changer, and it's not just a a change for now. I truly believe, has not only enhanced your life, but it has prolonged your life as well. And how long do you have till retirement?
11 and a half months.
11 and a half months. Yeah, that's awesome. That's awesome. All right. Well, thank you so much for being a wonderful patient.
Yeah, thank you, Dr. Watt.